Good morning, everybody. Welcome to Pediatric Grand Rounds. This is Suzanne Mazer. I'm Director of Continuing Medical Education here at Seattle Children's. So, Dr. Leslie Walker Harding is Professor and Ford Morgan Endowed Chair of the Department of Pediatrics here at Seattle Children's and the University of Washington. She's Associate Dean of the University of Washington School of Medicine and the Chief Academic Officer and Senior Vice President of Seattle Children's Hospital. I was just thinking that 2020 is her first full year in this new role. Is that right, Dr. Walker Harding? And it's been a really, really
Yes.
interesting year. So we're really excited to have you speaking to us today in our final grand rounds of 2020. So welcome, Dr. Leslie Walker Harding.
Thank you very much, Susan, and good morning to everybody. I'm so glad that we have put this state of the department grand rounds at the end of the year, especially this year, because it's hopefully a good summary of the year and we can move on to next year. I really look forward to celebrating the department's achievements in the past year and discuss our progress in achieving our goals that we have set for improvement. You know, what a time this has been this year in this place at this time in history. Some of the biggest trials we have had in our lifetimes have happened in the last year. And while we've been trying to improve the health of and well-being of children and families, we've also had to add on top of this, helping people to just live, helping their families stay alive. And while at the same time doing that, we simultaneously are dealing with the same issues in our own personal lives and helping our families stay alive and be supported and be as healthy as they can be, trying to conjure up all of the compassion, patience, faith, power, fortitude that we have to really be present in all fronts. Many of us have experienced a profound social awakening this year with the national focus on how racism has affected our world, our profession. Many people are more aware of how it's limited the potential of centuries of Americans from being able to achieve what we all call the American dream. And in turn, some who have lived with these limitations with no end in sight have been thrust unexpectedly into the spotlight and have alternatively been hopeful, disheartened, and really challenged this year, adding to the tumultuous year of change. Leading the department this year for me has been at times challenging when there are no quick answers, no satisfactory answers for some of the hard and more devastating and life-changing problems we've had to deal with, on top of the usual concerns that faculty and staff may have experienced in an academic institution. It's also at the same time, though, been incredibly rewarding and reinforcing of the values that I thought we had that have never been truly tested as they have been this year. So while many of us, I'm sure, just wish this year would end and we would have a new beginning in 2021, I am grateful that we have found out how strong this department is and how we can step up even in the hardest and most unimaginable of challenges to do what we came here to do with the people that we hoped to do it with and partner. This year, as we look back on our accomplishments and the strides to still move forward, please reflect on how well we have been able to look these challenges in the face and come out, I see, even stronger and more of the more aware of the strengths that we have in the best pediatric department in the country. So first, I really, again, just love to thank you and give you high appreciation for all that we have accomplished this year. We've had many sacrifices as a department we've had to make. There probably are more coming. As we get through the COVID time, we felt the pain of others, and I've watched people pitch in and really work with each other, seeing other people have personal challenges and need to step out and really care for their families, people who have been at higher risk being really supported in their groups to pull away from clinical work. It has really been a year, I think, of so much giving and strength that we have shown each other. In particular, I'd like to call out our staff who took furloughs, to help with our financial situation within the university and the department. Another sacrifice. All of us have seen sacrifice and seen things that we had to work and compromise. Outcomes we wish we would have. We had to kind of reassess what we could do this year. But through it all, I think we've really shown each other the compassion and caring that I would hope we would. And so I say thank you with that, and I hope that we can continue to move forward a little faster in the next year. So first, what I'd like to do is give you just an idea of where the department is with some vital statistics, some basic statistics comparing last year to this year. I also am going to talk a bit about what we have worked on in terms of realizing our vision and our strategy for the department, as well as talk a little bit about our financial situation and some of the main accomplishments that I think have been wonderful within the department and different divisions and different people who've had recognition this year, as well as some of the goals that I hope that we'll work on in the next coming year. So let's start with the vital statistics. I think it's just continually impressive how we continue to grow over the years within our faculty. As you see, we've grown from 526 paid faculty to 556 faculty. And if you look down here, it says new faculty provider appointments, 162. Last year, that I think was 96. And so I asked, how many of those people are new? Because if you change your appointment, going from acting to assistant, you're in that number. Well, there were 96 new people that have joined us that were not at the University of Washington this year. So it's pretty incredible. And what's even more incredible about that is people have joined many, in the year during the time that we have been isolated and not really have been able to meet each other, interact in the hallways, have meetings in person. So I know this next year, hopefully as we have more security from the vaccine and things get a little better, that we will be able to again meet each other in the halls, organically meet, have coffee, think about things together, because I know that's isolating to move from somewhere else, come into a situation where you're isolated in a new job. So we still have a lot of welcoming to do next year, but our faculty continues to grow. And we have completed 3 of our division chief recruitments. We still have 2 hematology, oncology, and hospital medicine that are in their last stages. And if you look a little more granularly at where people are in this 556 people, 320 of them are faculty scientists or clinical scholars. And remember, this past year we changed from clinical educator to clinical scholar in terms of terminology, so that it was more accurate to what people are doing. And if you look here, you see that we still are very professor heavy in that group. And that's one of the things that we will be looking to do is, better balance some of that. You see we have 167 clinical faculty that are spread out, a little more, again, balanced toward senior. And our research faculty didn't change too much. We continue to have about 11 research faculty and 37 acting faculty. I show this to you. It's probably, you cannot see, I'm not sure how well you can see all of the names, depending on what kind of screen you're looking at this on. But I show this just to show you that last year we had a lot of empty spots. We have filled all the 5 new associate vice chair positions, and we have our new division chiefs. If you pay attention to Erin Allen's, the vice chair of finance and administration, if you look at her group, we've hired just recently, again in the fall, Emily Allen, whom I'm sure many of you have not met yet because of isolation. She's our new associate director of operations, and has been really hitting the ground running and helping and doing a lot of work, but she's also new. We have some, if you look at the graduate medical education, Sangeeta Hingarani, she is now the co-director with Margaret Rosenfeld for the Fellows College. So there's some changes here. So if you have time, it might be good to take a look at it. And I also would love to highlight McKenna Foe, Lauren Stanek, and Malika Sharabu. They have been outstanding. It is really hard to really manage the department from a distance, and they have done just an outstanding job. So I would love to, highlight the work that they've done. And if, again, looking a little closer so that you remember who our associate vice chairs are and our vice chairs are, I just wanted to highlight that a bit. I think it's very important to know because they're doing a lot of work and trying to connect with the faculty. And if you have questions in the areas of equity or basic science or clinical research, regional services, quality and safety, those are the go-to people who can really kind of hit the ground running and hopefully give you some quick answers. And they've all been doing an outstanding job. And I wanted to just highlight again our new division chiefs. Some are new in their roles and not new to the organization. And it was really exciting to see how competitive and how many amazing people we had for all of these positions to really try to decide between. And it's really exciting. We're going to have Dr. Essie Morgan she's coming from Cincinnati. She'll be starting in February. Evelyn Shu was already the acting division chief, and she just this past month has become the permanent division chief of gastroenterology and hepatology, and it was very exciting. Dr. Tumani Coker also was here, and she has now become, as of January 15th, she'll be the division chief for general pediatrics. So it's, please, as you see them, welcome them if you and congratulate them if you have not been able to do so yet. And here's a picture just so you can see Emily Allen and know who she is when we get back to seeing people in person. She is our new associate director and works and partners with Aaron to help run the whole department. This is another new group that it's not a new committee. We've had a diversity committee for many years, but it's been reconstituted. And Sabrine Akhtar is our chair of that group, and they've been working very hard. I wanted you to see who's on this group to show you the diversity of faculty pathway, diversity of rank, and types of people and different ideas that hopefully will come out of this. One of the things they're working on most now is to get the climate diversity survey that we've done in the past. That's going to be, oh, there we go. It looked like the slide disappeared for a minute. That's going to be delivered hopefully early in the next year in January or so to everyone. So please fill it out. We haven't done it in a while, and I think it's important to understand where we are. It will help the group decide what we're going to be doing in terms of our strategic planning around diversity, equity, inclusion, and anti-racism efforts. So when it comes out, please take time. This group has worked hard to along with Jason Dean to make it easy to do and give us the kind of information we need. Another group that is new that I just wanted to highlight, I think Jeff Sparing in the town hall last week talked about it, but I just, sometimes it's good to see things a couple of times. And so with the new structure and the clinical arm of the Seattle Children's System, we now have faculty representation where prior to that there was none. And so the stars are our faculty who have been appointed to the different committees. Some of them have started to meet. Others are going to be meeting for the first time in January. And as you see, we have Bill Walker, Sunny Jewell, Kate Pehoker, Evelyn Shu, Laura Richardson, and Mark Lewin, who will be have a real important voice in what's happening. Additionally, if you see, I didn't start, but Jody Smith is also on a couple of the committees. She's our faculty member, and she will be representing the Research Integration Hub, really trying, it was important to make sure that as we're answering questions, solving problems in the clinical realm, that there's a connection with our research so that, we have much more seamless help in that area. And so, as things happen, as you remember, problems come up, new initiatives need to happen, they will come first to the executive councils. They will make recommendations to the clinical operations leadership team. And, the clinical operations leadership team may make that decision, move forward, or come back to them, ask some questions, and eventually come up with a way forward. If there is not resolution or there's some questions, it will go to ELT. But this is really to help make the decisions that happen in the hospital around clinical operations at the clinical operations level and not always at executive leadership, really bringing it more to the people who are actually in the clinical operations and doing the work, having them have much more of a voice and partnering much more with the administrative vice presidents and service line leaders, so that we have a voice and really can come up with hopefully some outstanding solutions to problems that we have and new initiatives. So what we've done this past year, pre-COVID, we had our first department retreat with leadership. And then we had our second one during COVID. It was a little delayed because of some restructuring we had to do it online. But we've been doing a lot of work that was really spurred by first, Richard Sugarman and the vice chair of faculty development doing a survey a couple of years ago, asking faculty what was it that they saw we needed to do, focus on, change, embellish. And, we truthed that last year in one of our meetings to see, yes, these are still things that are important. So we started our retreats really trying to answer that. And we came up with 5 different areas that we have been focusing on. And so I wanted to just give you some update on where we are in those different categories. 3 of them are division and departmental faculty track distribution, academic administrative service time, and clinical support infrastructure that are on this slide. And again, I kind of alluded to it when I was talking about the balance, but we're really looking at what the department thinks is a good balance for the kinds of pathway people we have on different pathways. And it was really the split of having 40% clinical, 30% clinical scholar, 30% research would really give us the kind of balance that we need to have our clinical operations go well, have thriving research initiatives and clinical scholars and education. So we are not at that balance right now, and we will be looking at how we can do that. And some of the work right now is sitting with Eric and Aaron and Tim and looking at how we can finance the changes that we would like to make, and also standardize them so that we don't see wild shifts in different departments. It is unclear that there are some departments that will have more faculty scientists or some departments that will have more clinicians, but we want to make sure as a department as a whole we really roll up to the 40-30-30 split as close as we could get over the next few years. Academic and administrative service time, again, there's differences between divisions. We're talking about why those are there, how do they make sense, what are the expectations when people have academic or scholarly time. We need to be a little more clear, even on there's Seattle Children's time that's given for different things, and there's also time that the department gives. And so we need to be clear on what people are doing. Is it the right amount of time? Do they need more? And how we can really keep track of that. So that group is working on it. And again, there's been recommendations that people need. I'm sure you're aware. People really need in all of the different pathways a bit more academic time or scholarly time. That would be preferable. So we're seeing what the department can afford and how we can move forward with that. The clinical infrastructure support, again, that's something we have to partner with Children's on, but we're really trying again to drill down to see how each division, which is very different, has made things work or not work, and really get some shared wins. And with that, try to create a plan that we can really propose to the business administrative part of Children's to see how we could better have support in clinical infrastructure. The last two are general administrative support and recruitment strategy work group. And with the general administrative support, what we're looking at is how can we as a department look at the resources we have in terms of administrative support and really maximize those. And as we maximize them, what is still left that we need to do? And then how can we use technology to better increase our efficiency? How can we do some things more efficiently with, dashboards, maybe some technological changes in how, we do call and different things so that it can, with the number of people that we have, if we can't increase that number, you know, um, significantly, we can at least have some sort of systems that will be helpful in making it easier to do the work. Recruitment strategy work group is really focused on how we can expand our applicant pool and, in terms of diversity of many kinds. We very frequently have concerns about how we manage spousal recruitment, getting a little more formal on how we deal with that in a process, and even relocation. How can we make that smoother? How can we make sure that the many different kinds of people that come in know the resources that they need in the community and how to access those easily as they move into our department and into the area. The other thing that we've done this year, I think, much out of necessity, is really look at how we can communicate. And with everybody being much more dispersed and at home and in small groups within the hospital, we had to think hard about how can we have better bidirectional communication with faculty, to the department leadership, to for us to really advocate for things we need within the hospital or the university. And so, as you know, we've had monthly town halls. We think those have gone well. I hope that we will continue those even after we come out of restrictions with COVID. We have, if you haven't noticed, had a new website design. And if you see a little picture here, it would be nice to go in. If you have suggestions on things you think need to be added to the website, please let us know so we can do that. We recently had the gender survey, which as the information gets analyzed, we will come back to you with those results. The diversity climate survey is coming soon in January or February. And the engagement survey that the hospital did, we're analyzing that data now, and we will be looking to talk about it in the next year as we get a good handle on it. It's the first time that our faculty have been included in the hospital's engagement survey. So it takes a little bit of time to kind of make sense of that. And as we do that, we'll get back to you with the information. But we hope that having these town halls and more frequent touches will help keep our information more fresh, up to date, and you'll be able to give us the questions that you have to keep us really grounded in where we need to focus our energies. In terms of our financial overview, in comparison to 1920, our annual budget is still about the same at about 135 million. There have been some shifts in terms of support. If you look down, there's a little more support for the 2021 budget that'll be coming from Seattle Children's, a little less from the university. Some of that has to do with changes in COVID and the state and what the university has. So all of the departments have had a little less support than they have had previously from the university. Grants have been about the same. The revenue hopefully will be fine. We've had some recovery of that. Some of the issues with the billing have been worked on since Go Live. Epic Go Live, there's still some billing that had not been captured appropriately and sent, but there's a lot of work that's been happening on that last couple of weeks. And Jack Salerno, who's our Vice Chair of Clinical Services and also COMG President, has been very intimately involved with some of that work, and it looks like some good solutions are happening, and we should recover costs that were kind of caught with the Epic Go Live. So if you look here, this is just our monthly productivity and pro fee payments, and you can see we were trending actually pretty good even during the recovery from the ORs closing with aspergillus, we kind of recovered. Then COVID hit, and you see the dip, and we have been in recovery since then. And this slide was made at the end of October. Again, go live, I think, changed some of the payments, and we hope that that will increase as the recovery happens. And so just in terms of our clinical mission with COVID challenges, we were one of the things, this had nothing to do with COVID, but in terms of expanding to the Swedish Issaquah site, that didn't happen. Our hospital medicine colleagues were affected by that. That has more to do with regulations and outside of the control of both children's and Swedish. So at the moment, that is put on hold to try to see how to better get around, better manage some of the regulatory concerns. Regional coverage, we've been able to do that in a very, surprisingly effective way with telemedicine. In ways people didn't think could happen. That has been helpful to continue to have regional coverage in places we couldn't travel. And the children's strategic planning did continue. It shifted, as Dr. Jasperian mentioned in last week. It's not really, it turned from a refresh to really looking a little bit differently and coming up with some new strategic plans. The university put the strategic planning on pause for a while, but then has since picked back up. In terms of pediatrics and the touch there, looking at the maternal fetal work and fetal surgery, and the NICU, all of that area is very much highlighted in the university's strategic planning. And we've had workforce challenges. I don't have to tell you that, with changes and kids having to be home for school, and changes in childcare, changes in risk. There have been a lot of workforce challenges in trying to make sure that we have enough depth if people have to go on quarantine or if they become ill. That has been successful, but I think it's really very tenuous, and so we continue to work with that. Scheduling is a big hospital initiative that's ongoing, and we hope to have more information as more and more of our divisions are optimized or have better scheduling capability than they have right now. And I mentioned the telemedicine already. So, when we look at ranking, as that is important or not important, it depends on how you feel about ranking. I think it's important to, just see where we are. And nephrology really jumped up to being number 2 in the country. I will tell you that some of these stayed pretty much the same. There some improved, some were a little lower. Things like CLABSI affected our overall, all of our numbers. We really have been struggling with CLABSI rates, which is an overarching category that affects every specific specialty. It's really wonderful that at least now in the new, since October, in the new year in terms of children's management, that we're under our goal. We've done very well. There's been so many different initiatives. One of the main ones I think that's important is the rounding on, the CLABSI, looking at lines and doing line checks during rounding. We were only at 60% and doing that on rounds. And that has gone up to, I think, in the 80% time. That really needs to be in the high 90s, but it's really wonderful that faculty have been looking at lines, checking in on them, making an assessment on if they're needed, not needed during rounds. That's one of the things that has shown to decrease CLABSIs. So with the work we're doing, I'm hopeful that we will see an improvement in this, definitely around the compromise we've had with having high CLABSI rate. And in terms of just with the university and ranking of departments, we're still in the top 10, which is great. And I think we're really the best department that I have ever been a part of or seen. as I've gotten to know other groups. So it's great that nationally people recognize us as well. In the research mission, I if you look at the total there, 186 million, with looking at university, SCRI, and Fred Hutch. For comparison, last year we had 120 million. There's a huge jump this year. A lot of that is due to our new infectious disease research colleagues joining the department. If you look at UW and Fred Hutch, those are actually down a little bit, which is consistent with other groups, but because we had such an influx of some amazing research colleagues come into the department, infectious disease, our overall total has been quite high. The SCRI in general, if you have not heard, has had the best year it has ever had in terms of funding. So even in the midst of a lot of the trials we've had, publications and funding have been astronomically going very well. And in terms of papers, there have been hundreds of papers. Some divisions have hundreds of papers all on their own. I didn't have every division's count of how many papers, so I can't give you a number, but it's very high. I think it's higher than last year again. Some people have been very productive and being able to write a lot of papers during this time. I know nationally there's been concern about women who've had to take on a lot more of the child care, and there have been some looks at how productive have women as a whole been in being able to produce more papers. So that's something that we have to pay attention to and try as best we can to support our women who are doing research and making sure that they have the time to do the things that they need to do. We've talked about Dr. Norma Rodriguez, who is our new diversity recruitment ambassador in Seattle in SCRI. Because she's recruiting for faculty, she really helps us as a department diversify our faculty, helps us make more connections with institutions and organizations who have a greater diversity of postdocs and faculty, MD faculty perspectives. So that's ongoing. She just started again in the fall. Hopefully you'll get to meet her. I did want to highlight here that Jody Smith this year has also been made the Associate Director of CCTR, and she's the Medical Director of our Research Integration Hub. And so congratulate her as well on being willing and interested in taking on more leadership ability. But again, that was a national search and we had a lot of strong candidates, and Jody really came out on top, and I was really happy that she agreed to take on the position. The other thing I wanted to mention before we get off of this slide is that we restarted the university PI meetings. I think they were there in the past and they kind of went away for a short time. And so both Margaret Rosenfeld and Stefan Capet and Bonnie have been doing that work, which has been great. And I know many of you have heard that Bonnie Ramsey will be stepping down as CCTR director. She will remain our vice chair. I'm very happy about that. She'll be remaining our vice chair of research. So, she will still be with us working very closely in all of our research endeavors. Nicole Hamblett and Jason Debley are our interim CCTR center directors, and they're going to be outstanding. It's already been great working with them. In our educational mission, I think it's just been incredible how they have responded to COVID, in particular with Susan, Marshall, and Heather McPhillips, and all of the chief residents and all of the residents, the pivot that they've made to have such depth in coverage, changing how they're covering, changing teams, areas where they're covering. I mean, it's been pretty amazing to watch them do that work. We've had the first national virtual residency and fellowship recruitment. The residency part is still ongoing. We'll see how that goes at the end of the year, but the fellowship, there have been some fellowships that went through match this week and have had some great results. So it'll be interesting getting the learnings from having a completely virtual recruitment session where people decide to come here without ever having been here. We have and I'll show you a little later, we've had a high in the number of underrepresented people apply. And some of it looks like it's due to our new health equity pathway that's a match. We've had so many people of all kinds say that they wanted to be considered for that pathway. And then I just wanted to highlight that Dr. Coker and Mendoza have their first people in the new T32 for child health equity research for postdoctoral trainees. So that's been exciting to see some of the new changes that have happened within education this year. And, you know, this was important just to again remind you that during all this time with COVID, all the time, our residents are, let's see, the red dots, our medical students and pediatric student clerkship sites are the blue dots. And Richard wanted me to make sure you know from Cheyenne, Wyoming to Bethel, Alaska is 2,708 miles. We have people within that stretch of land. We have faculty, amazing faculty doing research, really engaged teaching. And we have students and we have residents all across this wide expanse. And with COVID, there were some challenges early on, just in terms of some groups not feeling like they were ready with PPE. But people are back there. People signed back up to be educators of our trainees, and so Richard's done a lot of work with that to have that happen. But we're really in a good place here still. And last year, and I like to have a picture of the all of our new residents for the first year, but they actually haven't been able to have their normal um, picture and retreat. So I like this picture because the activism and the advocacy that they had around Black Lives Matter that really pulled the whole hospital and even patients into acknowledging and having a moment of silence together. And it was really quite amazing. And so I just wanted to remind us that all of this has been happening this year. And just real quickly, the work that we did in changing the research track really resulted in us in successfully matching 2 residents last year. I wanted to highlight that Anthony Bowie is just got accepted to be a New Century Scholar, which is wonderful. It's a national program that helps really mentor people who want to have academic careers. And so he will be beginning that. He'll be in the 2021 cohort. And we also have a new primary care sports medicine fellowship pediatric track, just so you know. In the Fellows College added a new offering for the introduction to clinical research methods to their already wonderful curriculum. And this is just real brief to show you, this was just as of November 1st. By then, we still were approaching the same numbers of people that applied last year. We weren't sure what was going to happen with it all being virtual. But as you see here, HE is the health equity track. And, we didn't have that before. We had 281 people apply to that pathway. And if you look down at URM, underrepresented it's underrepresented medicine people. We had last year 136 US people, and we went from that to 176 all and 135. So we've had quite an increase in our numbers, and it'll be interesting to see how that all plays out. But we were happy to see that the applicants number was similar to last year. And so this last part, I wanted to just again stress that I had almost a inch thick pile of papers, and one of these technology things I want to improve over the next year. But I had almost an inch worth of papers, of pieces of paper, of all of the amazing accomplishments that everybody has had in the past year. And so what I've tried to do is just take a thumbnail, just a little touch, so that people can see the breadth of what's happening within our divisions. Many people don't know what other divisions are doing, and so it's nice just to annually get a touch to that. But it is not comprehensive. It is not, it's not even close, not even a tenth of what's happening. But I think it's important to give a touch to some of those things. What I hope in the future is that hopefully in this year, if we can figure out how to do it, I would like to have a system that as things happen, the divisions can put into a digital system, so that either if you're going to make, some of the divisions make wonderful annual reports, you can pull that information out easily. I can pull it out, if we need it for different kinds of information for different reasons. We are able to pull it out of a database. I hope that we can get that set up over the next year, because it'll make it a lot easier to keep a better track of what's going on. I think it'll be easier for people to also input. So first, I just think it's so cool that both that Danielle Zaire and Dimitri Christakis got amazing awards this year. I cannot say enough, and I'm sure all of you feel the same about Danielle Zaire's amazing work in helping us get through, understand, manage this whole COVID crisis. She has been outstanding, and she just went straight from aspergillus to COVID and has just, any award we could find to give her, she deserves. But she did get the David Fisher Award for Excellence in Safety this year, and it's really well deserved. She has done a tremendous job for all of us, and really leading the whole infectious disease division to help with the management of all of this work. It's been quite incredible. And Dimitri this year got the UW Science and Medicine Award. Not easy to get for a pediatrician, and so it's pretty exciting that he's honored at the university and will be speaking about his research. So together, I congratulate them for their amazing work. And then I also wanted to highlight our new people who've been admitted into the American Pediatric Society and the Society for Pediatric Research. The American Pediatric Society is typically for more seasoned faculty. I remember when I first started here, and Bruder said it's for the white people with white hair or something, he said, and I thought, and then one year he said, well, it's time for you to go in, and I thought, oh my God, I guess I'm there. I'm one of the older ones, but the people who have had impact in the country in pediatrics, that is that is who is looked at as an ideal candidate. And so this year, Shaquita Bell, Richard Sugarman, and Kate Peehooker have been inducted. So it's wonderful. It's something that we should all, think about being in. And I couldn't remember if Aaron Whiteman had been highlighted last year, so I put him in because he was admitted into the Society for Pediatric Research, and Lori Eldridge was admitted this year, and that's really an accomplishment for them, and it speaks a lot to their work and their research being recognized, and so congratulations. And then just recently, the university published the top 50 researchers listed on the most cited list by this group, Clarivate, and Brian Salins and Mike Bamshed were the two pediatric researchers who were highlighted there as being most cited. So look at their research. And just other people who have, and other things that have happened during COVID-19. I think there's some notable things that I just wanted to make sure people knew. In general, our research just exploded. There are people that have had, a couple of had new R01s, the ability to pivot and, refashion research, access funds to look at and understand COVID better. We have things from going from how schools are to vaccines to health disparities, to describing the infection and why it affects kids differently from adults. All of those areas, we have grants. People have grants and had support to do the work, and it's pretty exciting. And we know, Janet England's, study, research in New England Journal of Medicine and Nature have been transformative as well. So I just wanted to make sure people were clear at all the work that's happened around this. And then top doctors in the Seattle Metropolitan Magazine and Seattle Magazine. I think I got everybody. Sometimes people are in unusual categories, but again, we continue to have our community say that our faculty are top doctors and people that they respect and go to, and I think it's important that we also acknowledge that. And then, some of the notable um, uh, things that have happened. Uh, Drs. Shaquita Bell and Jason Dean are both in the AAP committee, national committee, and they have a policy statement. I'm not sure if it has come out yet or it's almost coming out for the American Indian and Alaska Native child health. That should be very, very, momentous, and we'll get some press and hopefully will be helpful for us across the country. And it's great we have two people who are part of that and will be authoring it. And I wanted to bring up, again, endocrinology and their setup. Whenever we get out of COVID and people can go visit and see, I think it's something that we would probably want to emulate in other spaces and show how research can integrate with the clinical setting and do well. Dr. Corey McDaniel, she has implemented a direct admission project that I think has been going very well, and I think it's important for our inpatient work, and so I just wanted to give her a little shout out to that. And I wanted to take a second to talk about some of our faculty who are further out and the work. There are quite a number of things that have been going on at Skagit Regional Hospital and the Pediatric Hospital Medicine Group around the birth center and simulation education that has been wonderful. And again, we all know that Joel Teeter is leading the new accredited Pediatric Hospital Medicine Fellowship. They just matched their second year and successfully matched a wonderful fellow that I saw trending on Twitter. The outcomes in inflammatory bowel disease have been shown and highlighted in the Improved Care Now network. Nephrology has this amazing pipeline of trainees that are going straight toward research faculty positions. So, there's a lot going on that I think is wonderful to highlight. Here are a few other things. I will just a second to say the first Washington State Foster Care Center of Excellence at Harborview is something really, I think it's just wonderful that we're able to have some impact in an area that was really needed. We needed to have a Center of Excellence to really help these kids have some continuity and the optimal care that they need. And then I'm not going to go through each one of these because if I did, we never have time for questions. But I just wanted to, take time. And later on, I have a number of slides that are in the back of this slide deck that go in detail about some of the work that we've done in the retreat work groups and, how we came to some of the decisions that we're coming to. And so I will have the slide deck given to Susan Mazur so that and Emily Rice so that you can get it if you like and look in detail and see what's happening and how some decisions are made and some of the wonderful accomplishments people have had. But just a breath of some of the many things that people are doing. I think Gina Sequeira, I'll just bring up, she got one of our first career development awards, 3-year awards through SCRI, and now she just got an HRQ K-12 at PedsNet. So she's and she's just been here since the fall. So she's really gotten off to a great start. So congratulations, Gina. A number of people are doing amazing and well. A lot of leadership positions across the country. And a lot of new president-elects, I think, that are in here. John McGuire will be making questions as in the American Board of Pediatrics Subboard for Pediatric Critical Care Medicine. That's a hard job. So kudos to you for being willing and getting accepted in that position. Bob Sidbury is our co-chair of the American Academy of Dermatology Atopic Dermatitis Guideline Committee. We have a lot of people making decisions that will affect their specialty across the country. within our department. It's pretty amazing. Um, General Pediatrics continues to have many people in AAP national committees, and Mike Baumschut is being very brave, and he's going to be the inaugural editor of in chief of the new Human Genetics and Genomic Advances journal coming out of their American Society of Human Genetics. That's getting up and running. So there are a number of other amazing groups that people are a part of. Hospital medicine as a big group, lots are doing, many things and getting national uh, influence and recognition. Same with immunology. They've, again, David Rollins is branching into an area. I think it's so important for us to really be a leader in co-founding Genta Bio and B Pharma this year. You've seen a lot of their work getting in New York Times in a number of areas. Let's see, looks like it went backwards. And again, just a touch of what's happening in each group. Jody Smith is the president-elect of the American Society of Pediatric Nephrology, and Joseph Flynn, the division chief, is also starting as the editor of Pediatric Nephrology this year, so he's getting that up and running. And again, more amazing stuff. Evelyn Shu is the president-elect of the Society for Pediatric Liver Transplantation, SPLIT. So, we have a lot of people getting awards and leadership. And then just again, you could come back and look at this more clearly, but there are a lot of strategic initiatives happening, a lot of work, big expansion of the gender clinic program that'll be also in Odessa, with a lot of amazing philanthropy. Nephrology just is finishing up re-establishing an expansion in Marybridge and looking further. So a lot going on. And one of the other things that stood out is there were a number of groups that put on their initiatives as they're doing a lot of EDI work within the division, health disparity efforts, looking at how they could have better impact. I mean, it was pretty nice to see that this is filtering all the way through the department. Lots of community involvement. Again, I couldn't put everything down, but just to give you an idea of how many people are in the community, leading, doing work, trying to make a difference on their off time, not just at work. And major transitions, I think, for everyone. Epic go live, telemedicine has really been, some of the things we're still going through, and transitioning, hopefully good things. And we hope that we'll continue to refine our telemedicine so that we can continue that even post-COVID, and make our services more available to many more people. And then just to, each group probably knows who retired in their group, but just so that everybody has a sense of who has retired from our institution. Here are the people that I had. I think this is everybody in this past year, and just, they've all had extremely important contributions to the department over the years. This is just to kind of order, last year this was the slide. These are the things that we were trying to look at. I think we've worked on many of them. And so these are some of the things we continue to work on. And we're hoping to roll out our diversity, equity, and inclusion, anti-racism training program to the divisions hopefully, this winter or spring. We're still working hard, even within the time of COVID, to find a way to appreciate people and, really have a healthy work environment. And the department strategy plans continue to move forward. One of the big things we're finalizing now is how the billing is changing some to what's called PSA method, and from the way it is now. I think just in the last meetings that we should come out pretty solid with this change, but it's still in the process. And continuing to try to adjust to the COVID financial limitations and still create opportunities within that. And just say thank you. And I know there's a number of things we probably didn't get the chance to talk about, but I just wanted to give you a little bit of a taste of where we're hoping to go and what we're doing now. So,
There is a question from Jeffrey Foti. Leslie, thanks for an excellent talk and review of our awesome department. It remains a privilege and honor to work with such incredible colleagues. Question, with respect to vital stats, do we have data on our retention rate and any associated goal or benchmarks?
that's a great question. And we actually are working on that right now. We have data on retention, or, when people leave, there's retirement, there are what we call recoverable, like people that we wish could have tried to retain, that may have been pulled away from another institution. Then there are people that leave for reasons that, we wouldn't have been able to impact. And so we're actually trying to drill down on what is our retention rate. We retain more people than leave, but we need to know, is there any patterns in the retention changes? And so we're actually actively looking at that. And next month, I think we're going to be looking at some of the data and trying to figure out, where that is and what we need to do to respond to it. We do exit interviews of people that leave. And so we're, again, culling through that information to try to see, are there any patterns? Are there any things that we can do better to retain people? But that is actively something that we're working on now to kind of look at that a little more.
Great, thanks. And from John Kogan, thank you for your talk. Are there departmental strategies to improve recruitment of competitive faculty across the country / internationally?
There's a lot of work in trying to make sure, one, that, it's hard, it's expensive here. And so trying to make sure that we can, one of the things this year that was important was trying to make sure that we maintained having some sort of relocation incentive, even when, you know, it was a little, when we can do a relocation incentive, we wanted to make sure that we were still able to. And so we tried to do that. I think we haven't had any pushback on that. So that is something that's important with recruitment, really reaching out and showing people what it's like. It's been a little more challenging because people can't come visit in the same way. But we have been, I think, very successful in recruiting people within research and within clinical focuses. But yeah, with how we can give them packages, help them to come here and do the things that they want to do. That's really what pulls people, because we don't have salaries like Texas, and we have a high cost of living here. But when we can craft a position that allows the person to do what they really want to do and show them that they have the partners here, that's what gives us more leverage, because we have such a depth in resources and people and ability to have people be successful in research and in clinical work. So when we can show that, we can kind of sometimes trump some of the other concerns that people have.
For our last question in our last minute from Dr. Hal Quinn, wonderful talk, Dr. Walker Harding. Thoughts on further strengthening of the town/gown relationship? I'm assuming that means community hospital, community provider, and the hospital. Correct. But Hal, correct me if I'm not right.
You're correct. Thank you.
Okay, good. Thanks.
So you want to know about the community
providers and the hospital providers, strengthening the relationship between them.
Oh, yeah. I mean, I think that's critical. It's actually on part of our destination and strategic planning that we need to have much more of a stronger tie with the people around us. I mean, we're not going to survive without that. We're not going to thrive without that. So there are, at the hospital level, and us, even within the department, trying to reach out a bit more, CME with, trying to ask and elevate the concerns that the community has. So if you have any ideas for that as well, please let me know, because that's extremely important, especially now.
Perfect. Thank you so much, everybody. It's 9:01, so I'm going to let everybody get back to their Thursday. And I'll just remind you again that there's no grand rounds for the next 2 weeks, and we will see you on the first Thursday in 2021. We really appreciate you being here, all of our audience throughout this crazy year, and especially Dr. Walker Harding for taking the time to fill us in on everything that's gone on in 2020. And we really appreciate you. If anybody needs the slides, I put my name and Emily Rice's name in the chat, and we can get those to you. And thank you so much. We'll see you all in 2021.